Essential services. Those which offer a clear health benefit and the lack of access to these essential services results in a significantly negative impact on the well-being of all members of that community. When we analyze this core of services, it becomes very, very difficult to say, let's pull this one out, or let's pull that one out. Oftentimes they are so interrelated that you can't separate them. But what happens if you stop doing orthopedic surgery? Okay? Those cases will go to Oahu, and those people who can afford will go. And again, you end up with a two-tier system of delivery. We try to provide basic services. What we know here is, and most people would argue that labor and delivery is an absolute core essential service. What we know here in Hilo is that close to half of our newborns are C-section. The national average is about 32, 33%, and one begins to ask the question, why? Is it because those mothers are at high risk because they didn't get prenatal care? Are they high risk because they are young mothers? Do physicians choose to deliver by C-section because it's safer for both the mother and the child, but also because we don't have a neonatal intensive care unit? Okay. So we begin to look at all of these critical services. It's hard to get to the point where you can make changes incrementally. So it becomes major changes in the configuration of our delivery. The services and the patients who migrate away from here, most of those are full pay or mostly full patients, okay, which further exacerbates the problem and sends us into a further spiral. It becomes almost impossible to cut our way out of and cut our way to sustainability. The flip side is, once we get to the most efficient operation we can, we have to look for ways to grow our way out of this. Look for affiliations, working relationships with others. We have to look at opportunities to cross geographic and organizational boundaries to do what's best for the members of our community. Here's what I think we know for sure. Our operating shortfall beyond June of 2015 is going to be something in the order of 15 to 18%. There's just no way around it. And attempts to close that gap through streamlining and efficiencies will be insufficient to close that full gap. We must have continuing subsidies from the state for this region, and to the extent that they fall short of closing that gap, we will have to implement service cuts. And I've talked about the implications of that. Here's what we also know and believe, that the ultimate solution will not be found in fixing HHSC, but in the restructuring and consolidation of all health care delivery in the state. And again, finding those relationships between different institutions and different organizations. The trends all across the country have demonstrated with clarity that managing the costs of care and providing reasonable access can only be accomplished by large integrated systems. With a population of 1.4 million people, Hawaii is a very small state. And one wonders if such a small state can support three major systems: Queens, HPH, and Kaiser. And where does HHSC and our facilities fit into that mix? I will close by saying that the quality of life in our community can be judged by the commitment we make to the education of our young, the health and safety of all our residents, and the vibrancy of our economy. And we urge you to work with us to commit the resources and energies required to accomplish these goals, not just for our local community, but for our larger statewide community. Thank you, and I think we'd be happy to entertain questions from you. Thank you.